Delegate Rosenberg, and I appreciate your time and attention this morning. And we are now live, I believe. And welcome to the House Health and Government Operations Committee's Health, Occupation, and Long-Term Care Subcommittee. I am Delegate Bonnie Cullison, sitting in for Delegate Rosenberg, who had other commitments and could not be here this morning. We have 5 bills on our agenda today, and the way that we'll proceed is the council will explain the bill to us. We'll give the sponsor a chance to make some remarks, and then we'll open for discussion on a bill or if there are amendments. The order of the bills are going to be House Bill 158, House Bill 256, and House Bill 345. With that, I think, Lisa Simpson, we're going to start with you with House Bill 158.
House Bill 158 is a departmental bill that renames the Senior Call Check Service and Notification Program in the Maryland Department of Aging and broadens the program to provide regular direct communication from the department to an eligible participant to promote wellness and purposeful social engagement. The department must integrate services with the Telecommunications Access of Maryland program within the Maryland Department of Disabilities. There were amendments that are the result of some questions that were asked in the Senate that have been distributed. And it's my understanding that the Senate is planning on adopting those amendments and that the Department of Aging has looked at them and there's been an agreement. These amendments alter the name of the program to be the Senior Call Check and Social Connections Program. They strike language specifying the types of communication and notification required by the program, and they retain current language regarding funding.
Thank you, Lisa. So I think the amendments are coming from Delegate Rosenberg. I will make them for him. So let's talk about the amendments first, which, as Lisa just explained, make some changes to the name and some of the communication efforts. So are there questions or discussion on the amendments? Is there anyone who'd like to move the amendments?
Move the amendments.
Second.
I have a motion and second. Any discussion on the amendments? Seeing none. Those in favor of the amendments, please say aye.
Aye.
And will there be any opposition to the amendments? Please raise your virtual hand if so. Seeing none, the amendments pass unanimously. Let's move now to the bill as amended.
Move the bill as amended.
I've got a motion and a second on the bill as amended. Is there any discussion on the bill as amended? Seeing none, then let's have a vote on the bill as amended. Those in favor, please say aye.
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 Any opposition to the bill as amended? Seeing none, bill passes unanimously. Okay, Lisa, we're going to go to you for 256.
House Bill 256 is a Department of Health bill. It extends the termination dates for the State Board of Examiners for audiologists, hearing aid dispensers, speech language pathologists, and music therapists, the State Board of Massage Therapy Examiners, and the State Board of Professional Counselors and Therapists, and the State Board of Pharmacy by 5 years. The bill also increases the membership of the State Board of Massage Therapy Examiners from 7 to 9 members, adding 1 additional licensed massage therapist and 1 additional consumer. There is an amendment that's been distributed that would reduce the amount of time the Board of Professional Counselors and Therapists is extended from 5 years to 2 years.
Thank you. So the amendment is in my name. And what I understand is that the board would like to do some work and in its processes and have the benefit of an audit so that they can get information to make some improvements. And that's why the Board of Counselors sunset is much shorter. Is there discussion on the amendments?
Move the
Any
amendment.
questions? I've got a motion on the amendment. Is there a second?
Second.
I've got a second. Any discussion on the amendment? Seeing none, those in favor of the amendment, please say aye.
Aye. Aye.
Will there be any opposition to the amendment? Seeing none,
Pretty serious litigation between the two entities.
okay, I think we got it. The amendment passes unanimously, so let's talk about the bill as amended. Are there any questions or remarks that folks want to make about the bill as amended? Discussion? Seeing no hands, can I get a motion on the bill as amended?
Move the bill as amended.
Second.
Got a motion and a second. Any further discussion? Seeing none, those in favor of the bill as amended, please say aye.
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 Any opposition to the bill as amended? Seeing none. Am I hearing something? No. Seeing none, the bill passes as amended, passes unanimously. Thank you. And Lisa's last one is the Interstate Social Work Licensure Compact 345. Lisa?
And so this bill we discussed last week, it would enter Maryland into the Interstate Social Work Licensure Compact. The subcommittee has already passed the amendments and the bill is amended. The amendments were just technical amendments. And then during our full voting session for the full HGO committee, some questions came up that they had actually come up a little bit during our subcommittee meeting last week, but having to do with the fiscal note. So we brought the bill back to subcommittee to hopefully get some answers surrounding the fiscal note.
So I am looking for a representative of the Board of Examiners.
I'm here, Karen Richards, Executive Director with the Board of Social Work Examiners.
Thank you, Karen. I see you down on my screen. Can you, the question we had in the full committee was last year we passed this bill and there was no staff required. And this year there in the fiscal note, there is staff required. Can you help us understand that?
Sure. So first off, I want to share that I started with the board as Executive Director of last February, so fairly new to the board at that time. I've been here a year now, and happy to report that all our staffing shortages have been addressed. However, when this bill came forward last year, just really wasn't as familiar with what we would need. So when it came back again, we decided to add another position. It's an Administrator 1 position. This position would help me work with the Social Work Compact as well as serve as Deputy Director. My board has over 19,000 licensed social workers. We are one of the only boards that doesn't have a Deputy Director position. So that is my plan for the role. I also want to share that in the fiscal for fiscal year 2025, we were actually allocated 6 merit pins, 2 health investigators, a data entry operator, 2 administrative officers, 2 administrative specialists, 3, and an administrative officer. We only took 3 of those pins. So we took 2 of the health investigators because we absolutely have to address our backlog of compliance cases. And we took 1 administrative officer to work with our continuing education unit. So we gave back 3 pins. So I actually did not think that there would be a concern about taking 1 more pin back this year to work with me as the Deputy Director around the Social Work Compact. Additionally, we're facing additional legislation under Senate Bill 379, which is looking to make a major change to our statute. I really think that the staffing is justified, giving some of the changes facing our board, the fact that we we had a backlog of applications. We are now operating within our 60-day COMAR, processing our applications. I do not want our board to fall back to where it was a year ago. In particular, addressing the social work compact is very, very important to all of our licensed social workers. We support it wholeheartedly. But I want to assure that when this legislation is passed, that we are not going to fall behind again and not serve our licensees. I just, and again, I feel like it's more than justified given we didn't even take all 6 of the pins that were allocated to us for 2025. So if anyone has any questions, I'm happy to answer.
Are there any, thank you very much, Karen, for that explanation. Are there any questions from the committee? Okay. Delegate Morgan.
Sorry, I'm being technically challenged this morning. Thank you, Madam Chair. Karen, I just real quick. So I gather what you said, and I understand the situation. So you're saying that you were offered 6 pens, I guess, and then you only
in
took
the
3 of
allocation.
those.
Yes.
And now there's another requirement coming into your board, and you feel like that you should have, another requirement. So
Correct.
So it's not necessarily, is it just this bill driving that? So if this bill didn't exist, you could accomplish the mission of the board perfectly fine, correct? Because you didn't have it. Because I mean, this is what you agreed to last year when you got rid of the pens.
Right.
So
right.
now you have another requirement coming in on the
Right.
board, and you're feeling like you need another position. Mike, is that an accurate assessment of what's going on?
Correct.
Okay. So with that logic, if this compact bill passes, and after the compact is set up, what would that person now be doing?
So as I had stated, and I do want to emphasize again, please remember that we are special funded, not general funded, because I understand there are concerns with the budget. Also, to join the compact, licensees are going to have to pay a fee, and we are going to be administrating the fees for the compact. So, there is that to help balance off the cost. In terms of what the position would do besides just the compact, so as I said, we are one of the few boards, for example, the physical therapy board probably has about over 9,000 or so licensees, and they have a deputy director. So this person's going to serve as a deputy director. I need somebody to assist me with, our staff. We have 15 staff members. Some of the personnel matters. Again, this is my plan. We hope, and our plan is to increase our licensees. We want to be able to address the behavioral health crisis by licensing more social workers. So we want to be prepared for that. I want to be prepared to not fall back into where we weren't able to process applications within a timely manner. I want to be able to have our board be more transparent and provide more information. We've started a digital newsletter, monthly digital newsletter to our licensees. There's so much more we can do. And I would like this pin to be able to, to assist me and help move forward the board. We are trying to work on a process where we are moving away from our paper applications and becoming more digital. There are, even once this compact is passed, I promise you.
Right. There's other conditions the board, and look, I don't want you to feel like we're attacking the board or something. And that's not what we're doing. I
gotcha.
I have a fear that the board and you collect your special assessments and that money gets parlayed up in your account. Now it's getting scraped back I think you're inadvertently getting tied up into a situation of a problem much larger than you. Your board's just being held accountable for it. And it was the first time we stumbled upon it, to tell you the truth.
Yeah, well, and can I share that, I did the fiscal note before the Bertha bill came, so
Hey, sweetie, I'm on a call right now.
We
Yeah,
need
and the
everyone
Bertha
to
bill-
please be on mute. If you're Dan, Dan,
Yes.
can you be on mute, please? I think
Sure.
we're hearing. Okay, thanks.
Yeah, the Bertha
sorry.
bill, in the Bertha bill, the amount they is looking at the fact that our board has been operating with kind of a little bit of a slush fund with extra, but the reason we've had extra is because we had vacancies that weren't being filled. I mean, all due respect to my predecessor, they're just, there were positions that were a year that were not filled. I came in and I've gotten all of those vacancies filled, working with HR. So
Gotcha.
I'm
Yeah.
concerned,
Yeah,
definitely.
and rightfully so. So, well, thank you for your information and everything. This has been very helpful. So appreciate it.
Thank you.
Thank you, Delegate, and thank you, Karen. Lisa, if I'm understanding the subcommittee actually passed this bill last week.
Correct.
And so now we can take this information back to the full committee. We don't need to vote again.
Correct.
Okay. Now, if everyone is satisfied with that, if anybody has a question or concern about it, please raise your hand. Don't see anyone. So, Lisa, I think that's. Oh, I'm sorry. Delegate Bandari.
I have a question, Karen. Is he there?
Yes, she's here.
Yeah, I'm just wondering, are there any federal grant funding available? Many states have offset cost using federal workforce grant and compact funding opportunity. Can our state do the same?
That would not be a question to ask me. I would say the Behavioral Health Administration deals more with workforce issues.
Okay.
I'm certainly willing to discuss that with them in terms of licensing social workers, but it's not my understand. Right now, our focus is on licensing social workers in Maryland, addressing our very significant our backlog on complaints and compliance, again, doing our best to license more social workers in Maryland. But yeah, it's something I'm always willing to discuss with anyone, meet with anyone.
Thank you.
Yeah,
Thank you.
and
Thank you.
we appreciate your efforts, Karen. Thank you so much.
Thank you.
Okay, seeing no other questions, Lisa, I think that finishes the bills that you are working on, and we're going to move over to Lindsay Rowe. Lindsay, if you would tell us about HB3.
This bill alters the definition of physical therapist assistant by clarifying that the term applies to an individual licensed by the State Board of Physical Therapy Examiners who practices limited physical therapy and has passed a specified exam, adds a second licensed physical therapist assistant member to the board, requires the board to send a license renewal notice via electronic means and provide such notice by first-class mail only when requested by the licensee. And then in relation to that changes the context of the renewal notice by including the date by which the renewal application must be received by the board for the renewal to be issued rather than issued and mailed, since they will not by default be mailing it. There are no amendments on this one. The cross-file passed the Senate this morning, 45-0.
The whole Senate. Thank you, Lindsay. Are there any questions on this bill? Any discussion? Can I get a motion on the bill?
Move the bill.
Second.
Okay, I have a motion and second. Any discussion? Seeing none, those in favor, please say aye.
Aye.
Any opposition to the bill? I see none, unless Delegate Morgan, you weren't talking to me, right? I saw you saying something. You're okay. Okay. Then the bill passes unanimously. Thank you very much. Lisa, let's go to House Bill 265. Not Lisa, Lindsay, sorry.
Fine. This bill, first I'll remind everyone, is jointly assigned with appropriations, so HGO is primary on it. The bill expands eligibility for the Maryland Dent Care Program to include dentists and dental hygienists employed on a part-time basis. The bill requires the Maryland Higher Education Commission's Office of Student Financial Assistance, in collaboration with the Department of Health, to establish prorated loan repayment assistance for any part-time dentists and dental hygienists participating in the program. And then, as introduced, also required by December 1st, 2025, the Maryland Insurance Administration to study whether dental insurance carriers are using an online credentialing system to process uniform credentialing forms and report its findings and recommendations to expand utilization of online credentialing. I circulated an amendment from the sponsor, Delegate Bagnall, to remove the requirement for MIA to do that study and report. And then I also circulated a second document, which was suggested amendments that came from Dan Doherty. So I can get into that. Do you want to take them separately? What would you like?
Let's take them separately, but I'm going to go to Delegate Bagnall first to speak to the bill and her amendments.
Thank you, Madam Chair. And this is a bill that passed this committee unanimously last year, passed the House mostly unanimously, with some slight alterations, one of which speaks to the amendment. We had requested a credentialing study. MIA said that they could do it independent of the statute, but would prefer the flexibility for it not to be in statute, and we were amenable to that, and that is the amendment that you see before us.
Do I have a motion on Delegate Bagnall's amendment?
Motion.
Who was that, please? Oh, Delegate Hutchinson moves. Do I have a second?
Second.
Okay. Any discussion on Delegate Bagnall's motion or amendment? Okay, seeing none. Those in favor of the amendment, please say aye.
Aye.
Aye. Anyone opposed to the amendment, raise your virtual hand. Seeing none, that Delegate Bagnall's amendment passes unanimously. Now, Mr. Doherty, Dan, you want to speak to your proposed amendment?
Yes, excuse me, Madam Chair. Yes, I would. During the course of the hearing, the question was asked whether or not, or what was the problem with the Senate last year, and it was the fact that in the bill included a limited license. When you look at the language from the statute, it is clear that the terminology license used in the bill includes every classification of license for dentistry and dental hygiene, including a limited license. So what the First Amendment does is propose changing the term license to a general license. And that would limit it to individuals who have a license which gives them unrestricted rights to practice dentistry or dental hygiene. You want me to go to the Second Amendment, Madam Chair?
Yes, go ahead, and we'll talk about both of them at the same time.
Okay. The Second Amendment addresses, the MSD had a concern about extending this to part-time practitioners for fear that, number one, it might dilute the monies available for people willing to practice full-time in these underserved areas. The testimony that was presented at the bill hearing was primarily about the need or the desire of dental hygienists to practice part-time. The discussion with my client, we felt that they had made a relatively strong case. However, the only reference to dentists being part-time was one or two individuals, and they were not practitioners asking that they could be included as part-time. We feel that maintaining full-time participation by dentists is important in, number one, not only getting them in for 3 years, providing care to Medicaid patients, 30% of their practice to Medicaid patients for 3 years, but it also is a vehicle and to have them, after practicing there, make a decision to continue and establish their practice and their involvement in these areas on an ongoing basis. So Amendment 2 takes the provisions dealing with part-time and limits it to dental hygienists only, but maintains that dentists will be full-time practitioners. So those are the two amendments.
Okay, thank you. I appreciate the explanation. I'm going to open it now for discussion. Please raise your hand, your virtual hand, if you would like to discuss these amendments. And I'm seeing Robin Elliott. Good morning, Robin.
Oh, good morning. Thanks for the opportunity to speak about this bill. I work with both the Maryland Community Health System, which is a group of federally qualified health centers, as well as the Maryland Dental Action Committee. They feel very strongly that we need a part-time eligibility option for both dentists and dental hygienists. At the hearing that you held, you had a dentist from Chop Tank who testified as to she lived on the shore for four generations, and just the value, excuse me, the value of being able to have a part-time option for work-life balance. It's notable, and of course, this option can benefit everyone. We do know statistically women are more likely to work part-time. And now 56% of graduates from dental schools are women. But of course, we want the option for men as well. This is really the request from our federally qualified health centers, who are really struggling to fill both positions for dentists and dental hygienists. And the part-time component really could be helpful in recruiting more providers to serve people who are enrolled in Medicaid, as well as people who are uninsured. Thank you.
Thank you, Robin. Robin, do you have a position on or information on the amendment number 1, which classifies it to a general license?
Yes, actually, my colleague Michael is the expert in that, and I see him popped up on the screen, so I don't know if
Okay.
Michael would like to address that if you'd like him to.
I will in a minute, because I'm going to take Delegate Hutchinson's question or comment first.
Thank you, Madam Chair. I really just want to echo Robin's comments. You know, being on the Eastern Shore, working with Chop Tank Community Health, I know they're very much in favor of the part-time component. They do think that will help with our workforce shortages that we have. It's a definite need and a desire, and I continue to want to focus and work on solving our workforce shortages. So if a part-time option is advantageous, I'd be very supportive of that. Thank you.
Thank you, Delegate. Michael Patty.
Oh, great. Thank you, Madam Vice Chair. Yeah, I just wanted to talk about the First Amendment proposed by MSDA, and just, you know, I think we're hyper focusing on a handful of words, and need to take a step back and look at the entire section. So in that part of the law, specifically 18-2404, there's a 5th criteria that says that the loan assistance repayment program, that an applicant must meet any other criteria established by this office. And that office has reflected who's eligible for this program very specifically in regulation. That regulation states clearly that it's an unrestricted license. It's been in regulation for a number of years. And I'll just highlight that the B licensed part of of this bill has been in law since 2000. It's never been an issue apparently until right now. So I'm just, you know, I'm unclear on what needs to change when there's a catch-all, and that it's reflected in regulation. And the last thing I'll add is, uh, there's a physician and a physician assistant loan repayment program. There's a nurse loan repayment program. They have other restrictions. They have different types of licenses. They don't make this distinction in statute. This is clearly a regulation issue. And I think the bill's focused on expanding it to part-time dentists and part-time dental hygienists. And we're not focused on that.
Okay. Thank you, Michael. Ms. Dan Doherty, please.
Yes, Madam Chair, if I could respond first to the issue of the general license. In 2000, when those regulations were adopted, there was not a limited license to practice dentistry in the form that we have it today. Secondly, anything that is passed by the General Assembly would supersede existing regulations. So in light of that, leaving it as a license would thereby authorize a limited license to practice to be included in the purview of this bill. We feel that for purposes of clarity, you need to have general license in there since, as Michael Patty said, unrestricted license is what the regulation says. That is a general license. Let's make the two consistent. With respect to the part-time dentist, again, we have applicants far exceeding the number of slots to be given to provide grants. I think it's very logical that if someone is settled full-time in an area such as the Eastern Shore, Cumberland, Garrett County, and they practice for 3 years providing care to this underserved population, that the odds are much greater they're going to stay there as a practitioner after the 3 years are completed if they are full-time. If they are part-time, that is less likely. However, we do feel the dental hygienist situation is different. Many dental hygienists in private practice are working part-time, so it's logical to add part-time dental hygienists, but we do not feel it's advisable at this time to include dentists in that.
Okay, thank you. Michael, you want to respond?
I just wanted to make one point. I mentioned other two loan repayment programs. The Dent Care loan repayment program is very unique in that it sets minimums that applicants must receive. So when we discuss, how many applicants there are and how much, money this program goes to them, the physician program, the PA program, and the nurse program, they have the ability to take more applicants because there's not a minimum in law that's set in law. This bill's not addressing that. I just want to highlight that, that's what makes this program unique. So I think, we should just, take that into consideration, that we can make this program even more accessible, if you want to look at other parts of the loan repayment program.
Okay.
Madam Chair, could I respond?
Yes.
I think that one thing we must focus on is that under Medicaid, the reimbursement level for physicians for procedures is much closer to normal reimbursement than it is in dentistry. Many of the procedures that dentists have to provide to this population even don't cover the overhead and the cost of providing it. And the ones that do, it's a very narrow margin. It takes a lot to induce people to go down there and stay, obviously, for 3 years. Having a grant that offsets their huge tuition debt is an incentive, but we need the incentive after those 3 years are completed. And we feel that the one way to do it without drastic changes to Medicaid is to have them in these underserved areas for 3 years, living there and being part of the community. That's not going to happen to the same extent if you extend this to part-time dentists.
Okay. I'm going to go to Delegate Bagnell as the sponsor first, and then Delegate Bhandari if you had a question. Okay. Delegate Bagnell?
Thank you, Madam Chair. And I I respectfully disagree, as I did in the hearing. I think it is is a fallacy to assume that because somebody is working part-time that they are not investing in the community. As I stated before, there doesn't seem to be any data to support that assertion that someone who is working part-time and who is dedicating their time, to your point, at a lower reimbursement rate, and is also investing in that community, has children in the school system, is setting up their home and their work in that community, is somehow less likely to continue to serve that community. And I just respectfully feel that this argument makes me more inclined to ensure that part-time dentists do have access to this grant program.
Okay, thank you. Delegate Bandari, did you have a question?
Thank you, Madam Chair. Jan, given that this bill currently includes limited licenses under the existing definition of licensed dentist as per the Dentistry Act, how does striking be licensed and replacing it with hold a general license ensure equitable access to the Maryland Dent Care Program for all qualified dental professionals, particularly those with limited license who serve underserved communities? And would this amendment potentially exclude dentists who hold limited license but provide essential services, thereby reducing access to care for Maryland residents?
I don't think
Dan?
it would reduce access, but the distinction is that a limited licensee, particularly in the area of internationally trained dentists, are on an alternate path to be to receive a general license. That alternate path is in lieu of completing a required 2 years of dental school. So they are comparable in the process of a dental student who's in their 3rd year of dental school. They're not eligible for the program. The program requires that you be a graduate and that you have a general license. Because they are on the path to meet these educational and alternate requirements, they should not be eligible. It is not discriminatory against them because of any reason other than they're in the process of completing the requirements to be fully licensed.
Okay, thank you, Dan. I'm going to take Delegate Hutchinson and then Delegate White Holland, and we're going to see where we are at that point. Delegate
I'd like to make
Delegate Hutchinson,
move the bill as is.
as amended by Delegate Bagnall.
Yes.
Okay, I have a motion to. I've got a motion and a second to move the bill as amended with Delegate Bagnall's amendment. Those in favor of the motion, is there any further discussion? Let me ask that. Dan, is your hand up for further discussion?
No, it's been up since initially.
Okay, thank you. Those in favor of the bill as amended, please say aye.
Aye.
Will there be anybody voting against the bill as amended? Delegate, okay, just checking. Seeing no hands, the bill as amended passes unanimously. I want to thank you all for your participation and engagement in the conversation and responding to each other's questions. So thank you very much for that. The Health and Government Operations Committee will be having hearings today beginning at 1 o'clock. And since a lot of them are insurance and pharmaceuticals, it promises to be fun. See many of you at 1 o'clock in HGO. Thank you very much. This meeting is adjourned.
Thank you.